Hi, my name is Peter from Physio, and in this video I'm going to take you through the sciatic nerve floss. So with the sciatic nerve floss, what we're trying to achieve is that we make the sciatic nerve move a little bit better between the muscles that it runs through. So nerves, they run in between muscles and next to muscles and through little tunnels, and sometimes when there's overuse on the muscles, it can capture that nerve a little bit and tug on that nerve. And that can give symptoms like tingling, numbness, but also like a local pain or like super tight muscles that just can't seem to react well on stretching. Then there might actually be a nerve problem. So when we're doing a nerve floss, we never want to move the nerve and stretch the nerve to both sides, but we want to shorten it on one side and then move it to the other side. And what that will do, that will make that nerve slide, but we don't stretch it, because that's not what a nerve wants. That can actually hurt the nerve a little bit more. And especially if you have some symptoms, stretching the nerve can actually make it feel a little worse. So we don't want to do that. So the sciatic nerve, it comes from the spine, it crosses the hip on the backside through the bum, it goes in between the hamstrings and then goes into the calf or towards the shin. If we know how it runs, we also know how we can slacken and how we can lengthen it. So first I'm going to show you seated, and then I'm going to show you side lying position. Both work, but the seating one is a little bit more accessible if you're in the office, or to do it as you go. So what I want to do, I want to have, first of all I'm going to use my spine to slacken, and I'm going to use my knee to slacken and lengthen. Yeah, so first if I round my lower back, it lengthens it a little bit. If I extend the knee, it lengthens the nerve even more. If I pull the toes and the ankle up, it pulls it all the way tight. If I extend my leg or my spine, it actually decreases the tension on the nerve. So that's actually what I'm going to use. So I'm going to start all the way seated up. My spine is a little arched, and I'm going to extend my knee, pull my ankle up. There we go. Now I'm going to slacken it here, and I'm going to lengthen it towards the top side. Then I'm going to slacken it on the top side and lengthen it on the bottom side. And that's going to be my motion. I want to go nice and slow, and as I do this a couple of times, I should feel there's a bit of an increase in flexibility and motion. Yeah, I can also do this on the other side. So now it's stretch on the top side, relaxed here. Now I'm going to relax it there, extend there, and I'm going to move it back and forth. Yeah, max of 10 reps, that's more than enough, because we don't want to aggravate that nerve, especially when there's an issue. Then there's also a side lying option, and what that will do, it will give us a little bit more movement from the hip. If we're just seated, we can't really move the hip, and sometimes your sciatic nerve is stuck at the bum, and then we definitely want to move that hip a little bit more. So from here, I'm going to slacken it on the top side, I'm going to lengthen it in the hip, now extend, pull the toe up, then I'm going to unlock that there and move it like that. I'm just going to alternate those motions. And like I said, this is not a motion that you really want to feel. It should feel, but as you do it, it should feel like it's freeing up a little bit. There we go. So let's say your problem is right around the hip. What you can do is keep that knee extended, and we're going to move the hip the most. So there, round it, extend. So now, because the hip is the thing that's moving most, we'll get the most motion happening here. That same thing goes if my issue is somewhere in this line. What I will do, I will go here, that way, and that way. So depending on where the issue is, I can adjust the exercise slightly to make it more specific for that area. If my problem is in the calf, I can do that same thing. So I'm going to go there, pull my ankle up, and then
and that's going to be my motion.
So there's a couple of variations, but the important thing here is we don't want to move the nerve to both sides. So if you feel that really hard stretch, you want to ease off, because we don't want to go too hard on that nerve. And wherever your spot of tightness is, or wherever that nerve is not sliding, this is some variations where you can play around with. Yeah, so give that a go, see how that goes, and let me know if you have any questions.